this week on the Backtable Podcast.
As I said, I was part of the effort that created a resident and fellow section of SIR. I feel responsible also to the next generation. The other day, I saw these big numbers of there's increase in number of applicants to IR. It's one of the hottest and most competitive specialties to get into. I feel like we need to create the essential tools for the next generation of IR and interventionalists. It's not just in interventional radiology. All the interventionalists coming out and they want to have their own practice. There is this big effort of, independent interventionalists out there. So in order to enable those people, we need to give them the tools.
Hey everyone, and welcome to the Backtable Innovation Podcast. You can find all previous episodes of our podcast on iTunes, Spotify, and on backtable.com. This is our next installment in the Backtable Innovation Show, where you will hear stories from physician entrepreneurs who are helping to drive healthcare forward through medtech innovation. Today we've got a great innovation episode. We are here with the founder of Doctorize, which helps patients and procedural specialists connect. It's interventional radiologist Dr. Reza Rajebi. Reza was on our show before on episode 201. Do you remember that one? It was a while ago, man.
Yes.
Like 300 episodes ago.
A while ago, yeah.
Yeah. We covered jobs, the good, the bad, and the ugly. And that one was a lot of fun. Welcome back, Reza.
Thanks, Aaron. It's a pleasure to be here again.
Yeah, I don't know if you noticed, my background has changed. I'm recording from our new Backtable studio, which we've been showing off lately. We're actually holding some events coming up next weekend. It's been fun. It's been a nice upgrade.
I like the colors.
2.0.
Colors are awesome.
The orange, my new Backtable Creator Weekend hoodie pops against that blue background. But yeah, we're trying to stick to
that's
native
marketing right there.
There you go, man. Let's get into it.
Sure.
So for those of in our audience who maybe didn't hear that prior episode, Reza, tell us a little bit about your background. You and I met in Dallas I remember that Andrew Club that we met at in Dallas, and I was like, man, who is this guy? He's really sharp. He really knows his stuff. And that's when we first met, and it's been a pleasure getting to know you over the years. But tell the audience a little bit about your career and how you started this entrepreneur journey.
Sure. Thanks. Yeah, it's like I was listening to one of your other podcasts, and the guest mentioned Harvard. And they're like, this is like a bad thing, but anytime you start, if you're a Harvard graduate, you would in 30 seconds, you'd be like, I'm a Harvard graduate. So I'm going to do the same thing, but I'm not from Harvard. I went to Miami Vascular, and it kind of ties into it. I feel like it ties into it at the end, and you will see why, I think, as we start exploring this. So yes, I'm an interventional radiologist now for it's 11 years. And I started from academic interventional radiology and slowly shifted to more private practice setting. I did a OBL setting job as well for a while. That was right before COVID, and when COVID happened, things kind of changed. So I decided to change my setup again, and I'm still doing private practice at the moment. But this part, the entrepreneurship of my career, it has started since I was a fellow, to be honest with you. I always thought about new ways. I have looked into medical device. I have a couple of patents, medical devices. I have looked into patient outcome reporting and digitalizing that, which I know nowadays it's a big topic in interventional radiology, and people are trying to look into outcomes. And ultimately, I decided to get into marketing. And the story of marketing starts with my OBL journey, because when I was in academic IR, I remember clearly one time I mentioned marketing, and I was like, why can't we put up like a big billboard of our faces and show people what we do as interventional radiology throughout which was I think it was a naive way of saying that we need marketing. And I remember one of the responses were like, we work in a hospital, we have patient referral, we don't need marketing. And from there, look at this spectrum. And I know in interventional radiology, it's a huge spectrum, like people who are fighting to be 100% IRs and people who want to be in still like, traditional DR IR groups. And I feel like our approach to marketing as well, it has a spectrum. There are people who say that they don't need marketing. They have done everything that was possible and the patients should come to them, which I disagree with that approach. And there are people, for example, my prior OBL job, they did a great job with marketing. We had a dedicated marketing department. We had multiple marketing in the Dallas area, but I feel like the techniques were maybe outdated. Some of the techniques that we use maybe were not working properly, but they did a lot of work on marketing. So I decided to start this journey, just realizing that we are underrepresented as an image-guided specialist. You can call it interventionalist. In general, I'm not talking about interventional radiology alone, but I feel like especially with the trend now going to outpatient-based labs and ASCs, I feel like we are against some of the interventional radiologists and other interventionalists who are in this setup. They are against large practices, large hospitals, and they're primarily doctor-owned. So we don't get any sort of education about marketing in medical school, residency, fellowship. Nobody talks about marketing. So
Zero. Yeah.
Yes. So that was the initial thought about Doctorize.
Okay. Yeah. So it sounds like the problem you're trying to solve for it started with our specialty, which is actually the same way it started for Backtable, is the problem you're trying to solve is we don't really know how to effectively market ourselves and connect with patients, right? We're not taught that. It's really challenging to learn that even when you're out in practice. A lot of times in academics, that's not the priority. And then you get out in practice and you're like, oh my gosh, where are my patients going to come from? I have to go out and talk to these docs in person, these referring docs, but I also have to figure out this whole Google AdWords thing. I got to figure out how to, get on TV. I got to figure out how to get on the radio. Like nobody shows you any of that stuff. Right?
Correct.
And, cause I kind of had a similar journey as you, like in the OBL space briefly and out there. And it's not, you're right. Marketing is not the focus of a lot of groups, but it's also and I know which group you're talking about who's good at it, but it's also just not very time or cost efficient. Right? I mean, once you start getting a little bit busy, you can't be hitting the pavement anytime. You got to be in the lab doing cases.
Exactly.
And it's just sort of like chicken or the egg thing, right? And then marketing people are not cheap. They're especially a savvy one. They're expensive.
Correct.
So where do you start with that?
Correct. So that's the idea behind Doctorize, because I feel like many practices they're trying to do marketing in different ways. There is a lot of trial and error. A lot of people take this lump sum of money and just put it in one area of marketing, let's say Google Ads. And then all of a sudden, this thing for Google Ads, for example, it can grow fast. It can just basically take all your money from the marketing. And it's very difficult to check and see if it works. Most of the time, we don't have a measure to show that it works. So I feel like just practicing marketing in a silo, that's what is actually causing problem, because we can never show value. But if we focus the effort, for example, for Doctorize, I have a team of my co-founder has been in medical marketing for 18 years. Our director of marketing has been doing this for more than 10 years. Our UI UX person has been doing this for more than 10 years. So collectively, maybe there's more than 50, 60 years, and including advisors, we put a large amount of experience behind this work. And when you do an effort collectively, I feel like, for example, if you do the geolocation and you do the same thing in different locations for different doctors, I feel like we can reduce the cost. So you will have a dedicated marketing team that's working in your geolocation digitally, but the cost is being divided between multiple physicians. So we can probably cut the cost. And I understand you're talking about old school, like going to referring doctors and introducing yourself. And
lunch and learns and all that stuff. Yeah.
Unfortunately, that's outdated. It's pretty tired approach. As you know, a lot of people don't have time. The primary care is just writing their notes if they have a minute. You end up going to their office and you're like, you're feeling bad. I'm like, am I like, interrupting your daily work? What are we going to do? They put you in a lunchroom with some sandwiches and you're sitting there and talking to office people. Yeah. And which they don't have anything to do with patient referral. Like they're just MAs, and those people don't have to do anything with patient referral. So I think we need to change our approach.
Yeah. So I want to get into how the platform works in a few minutes, but I wanted to take a step back and talk a little bit about, you identified this problem, which is marketing first and foremost, and the fact that it could be more cost effective, it could be more efficient using software, basically, right? And so I wanted to hear, because when you told me the idea, the first thing I thought of was ZocDoc, but what I was not aware of, which you told me about, was that ZocDoc is primarily focused on primary care docs. You can't find a specialist really very easily on ZocDoc. It's actually very challenging. And that was also part of the problem, is if, my father-in-law asked me about finding a vein specialist just yesterday. And I was like, well, I'm in the know, so I can send him. But how do people like that know where to find a vein specialist? They have to go through their primary care doc first, right? And a lot of times the primary care doc doesn't even know where to send them. So, but the patients are more educated now than they ever were. They might be looking just to go to the specialist, not dealing with the hoops and ladders of the healthcare system. So I wanted to find out more about, I wanted to kind of take a deeper dive into, did you do any market research around the idea? You educated me about where ZocDoc fails, but what else did you learn in your journey before you guys got to the point where you're like, let's launch this thing?
Correct. So I would throw out a couple of numbers. One is there was a study done recently that showed, I think it was in Gen Z, there are 76% of people who were questioned with Gen Z people, they were actually looking for healthcare trends and recommendations online. So there is a major shift here that people and doctors need to recognize. In order to have a democratized healthcare, we need to have digital presence as the generations are changing. And also to remember that a lot of the patients that we talk about, I know they're elderly, but they also have younger caregivers. Those caregivers might go online and look for trends, look for treatment options. So I would suggest, if you go online, go on Google and search enlarged prostate, right? Let's just do an example. When you search an enlarged prostate, the first page of Google that comes, it's mainly large organizations such as Mayo Clinic, Johns Hopkins, UCLA, these big organization academic centers, because they spend a lot of money on their content optimization. They create a lot of content. Their content is valuable, updated. They follow the guidelines of Google, and they get into the first page of Google. Now, if somebody's paying for advertisement, you might see them there. But when the patient comes home from the doctor and the doctor tells them that they have an enlarged prostate, they're not going to go search for prostate artery embolization. They don't know about it. And if you put enlarged prostate, it's very difficult to find prostate artery embolization on the first few pages of Google. I think that's the problem that we need to attack. So my goal with Doctorize is to get our website in the selected treatments and in selected category of diseases. We're not doing it for all diseases at the moment. This is phase 1. We are focusing on minimally invasive image-guided procedures, and we're focusing on outpatient labs and ASCs. So our goal is to have Doctorize with SEO and creating good content, creating educational content. Our goal is to get Doctorize in the first pages of Google search for the disease. It's the same thing for ZocDoc. If you go and search for the disease, ZocDoc will not come up as your first choice. So this is the main effort that we are going to tackle. That's our goal, to get the website optimized to show up on the search engines for the selected diseases.
Yeah. Yeah, I didn't mention before, but ZocDoc has a $2 billion market cap currently.
Correct.
So in your market research, did you guys go study how ZocDoc got there, like sort of its pathway? And, ZocDoc's the one that comes to mind, but there's also like Health Grades. Are there any others that you see as maybe not necessarily kind of competition, but there seem to be dominating that space right now?
Correct. I think ZocDoc is going to be our first competition. The problem with ZocDoc, like you said, for example, I did this search and I have recorded the video, so I have the evidence. So if you say enlarged prostate in Houston, the first 10 pages of ZocDoc, it's probably maybe 2 urologists, which are probably paid advertisement. So they're featured on there for that disease. And there is no interventional radiologist. I did not see, and I know in the Houston market, there are at least a handful of interventional radiologists who have prostate artery practices. So ZocDoc model, and this ZocDoc has been around for more than 15 years. They have been around. Their initial model was to do membership, basically monthly membership. And a few years ago, they realized that that approach did not work. So what they decided to, because they couldn't prove value, you come there, you get your membership, and the doctors are tired of these memberships, as you know. You get the membership, you pay like so many dollars, and what is coming out of it? People look at it and they're like, well, I don't know how to measure where my dollars are going. So a few years ago, they decided to change their model, and they went for pay per booking. And now that's what they're doing, and that's what made them successful. Their market is basically $2 billion for that reason. But their goal, and I feel like their strategy, is quantity. They want to focus on primary care. But I think what we realize as a gap is, what about that subspecialty care? There is another number I wanted to put out there. There's about 45% of patients that say that if there is a physician that is not on their network, but they feel like they're going to get the best option, best treatment from that patient, they're actually willing to go out of their network and have that patient, that doctor take care of them. That's a huge number. 45% is a huge number. And that can be absolutely crucial for our purposes, the outpatient procedures.
Absolutely. Absolutely. So how did you guys decide which specialties or procedures to start with?
Yeah, so the decision was made a couple of ways. As you know, for number one, I'm an interventional radiologist myself. I have been in that space. I have felt the struggle. I have put the time of going out there, waiting for the marketer to come and pick me up, take me out of my clinic hours that, I'm the most comfortable to get in there and do the procedure, right? Take me out like I'm in a white coat. I sit in the car. We go to Chick-fil-A and take the lunch and go out there to the doctors. I went through the struggle. And then what I realized is, like, this is outdated. This is not working. And for me, it was very interesting because a lot of primary care doctors also did not know who we are. And this is, as you know, this has been an ongoing discussion in the society. We have identity crisis. A lot of people don't know what we do. And I feel like this is probably the most underrepresented population of doctors, which offer so much. We offer so much in terms of saving patients, doing procedures efficiently, getting them out of the door. They don't have to go into a hospital. They don't have to go through registration process. They come to their OBL, get their procedure done. And I feel like at the end, you also save dollars for insurance companies. Bottom line is, hospitals are too expensive for insurance companies. So there is a move to get people to go to outpatient settings if it's possible. So let us help with that move, right? So that was a decision to go out there and just focus on the specialties that are doing minimally invasive procedures and image guided, because that's what I do, that's what I'm familiar with, and I understand better.
Yeah, there's a book that I think we were talking about called Cold Start Problem, where you start with an atomic network, the network
That's right.
you know, and I think it's good to build off of that, building off of what you know, building off of your network where you felt the pain, but you also know that your network feels the same pain, and that's the problem we're trying to solve. And then you learn as you talk to other specialties like interventional cardiologists and vascular surgeons who have a lot of overlap with IR, that they're feeling the same pain. And then you talk to, interventional nephrologists and maybe ENTs and urologists, like, oh yeah, I noticed also that ZocDoc doesn't list any urologists for prostate, enlarged prostate. That's ridiculous. Like, let's switch over to Doctorize where the patients can actually find us. So I think that's smart, starting with a small network and then building out from there. It takes time. So have you guys thought about like the timeline of how long it's going to take to get to where you have the full breadth of surgical specialists, or is it even surgical specialists, or is it all specialists?
That's a good question. I feel like our goal is in the next year is to get as many interventionalists, IR, interventional cardiologists, and vascular surgeons, pain management. A lot of people nowadays, as you know, there is a Society for Interventional Oncology. People recognize themselves as interventional oncologists. So our goal is to create, like you said, to create the atomic network, because we need to have the core of people who are providing the service. Because if the patients come to the website and they cannot find, for example, if we were like in a large city like Houston, you come to Houston and you cannot find at least 2 or 3 interventionalists that offer the service you want, we're not giving a good service, because those people are out there. So for the next year, our goal is to focus on interventionalists. IR, as I said, IR, vascular surgery, interventional cardiology, pain management. And ultimately, you are correct, because there's a lot of surgical subspecialties, ortho, for example, plastic surgery, for example. They're offering urologists, they're offering services in ASC. So after we created that atomic network of interventionalists, I think that's where we can start branching out. But I don't want to because the team is it's a startup, I don't want to put too many responsibilities. I don't want to branch out too fast. So our focus is going to be creating a meaningful national network of interventionalists first, before moving to other specialties.
Yeah. Getting those early adopters, working through all the kinks of the software, which is always going to happen.
Yes.
Get those people. It's kind of like sharing it with family, because they're gonna, forgive you if you mess something up. They'll come back.
Correct.
Right.
That's correct. That's correct.
And so I wanted to kind of talk a little bit more about how the platform works. I think people listening, and myself included, first thing is, okay, I remember that, yes, Google AdWords is expensive. Having a marketer is expensive. How is Doctorize going to solve for that problem, the expensive marketing? Is this a subscription? Tell us about how you monetize.
Right. So the very first thing is registering on Doctorize. It probably takes 15 to 20 minutes for a doctor. Obviously, there are areas that we want to capture. We want to make sure that the physician is actually qualified about what they want to do. They're telling us that they can do. So through their education, through their fellowship, the understanding, their background, it's important for us to have that information. But it basically, it's so streamlined. Registration takes about 15 to 20 minutes. we let people actually on the website, we let people to answer questions, ask questions and answer questions. Like if somebody is if somebody sees that there is something that they want to point out, like let's say, how many prostate artery embolization have you done in the last year? If you feel like that's important for your patient, we let people to do that. I have talked to lawyers, and we're working on getting the terms and conditions in terms of monetizing. Our strategy are twofold. One is we are going to do like ZocDoc approach, because they did this and they have actually favorable recommendations from federal government saying that their approach of pay per booking is allowed. So we are going to follow the same concept, but our goal is to do it because we're working on smaller group of people. Again, this is a niche group of people. We're not expanding a net that's going to, like ZocDoc, that's going to grab all the primary cares in the country, which are hundreds of thousands of people. And our goal is to get a small group of people, but we are creating value for them by doing those procedures, correct? So our value is in creating the procedures for them. So our
not
model,
the clinic visits.
Yes, it's not based on clinic visits, because that's not going to be valuable for the doctor. If that will be a very small number. Now, our goal is to have a pay per procedure model, and how we decide on that is based on the amount of effort it takes to get those patients to come to that doctor, to that practice. So we are planning to, we're working with our attorneys on creating a terms of conditions, but our goal is to create this new model of pay per procedure.
Got it. Yeah, I imagine establishing those prices, like you said, based off of how much work it takes. Like, for example, I mean, a lot of things play into a lot of factors, like the incidence of a disease. For example, OA is a lot more common than fibroids, for example. So, if you book, are GAEs going to be easier to book than UFIs? And therefore, will that price be different? I think that's super interesting. Are you guys, I imagine there's going to be a lot of data collection that has to do with that. Are you guys, is there any sort of AI as part of your software to help sort through all that data you're collecting?
Yeah, so that's a great question. And the plan that we have actually submitted to NSF for a grant application, that's our next step, to have because this was kind of my passion from the past. I actually worked on this other platform in order to measure outcomes and measure statistics of what we do, because that doesn't, at least a few years ago, that didn't exist. We didn't know how to measure outcomes, how to decide which medical device, which procedure to do in what case. For example, like in PAD, do you do this procedure? We have a vast number of options available out there in terms of medical devices and whatnot, but we don't know which one is better, to be honest with you. We don't have that. And that was my initial goal a few years ago. And now with this platform, we are planning to incorporate that hopefully when we get the grant, or we can do other means of fundraising, is to incorporate AI. And I know AI these days, everybody talks about AI, but that's a goal. Yes, that's a goal, to incorporate an AI system that actually takes the patient and their needs. It's not just about the procedure. There are different needs. Their travel, like the patients want to know how to travel, how fast they can get there, how long they have to wait for their procedure, what's going to take to get the approval from insurance. These are all the factors that can play into that AI algorithm, and from there we can create as you said, we can create a grid of what procedure actually takes more effort from our side to have a target, let's say a target audience that goes and gets their procedure done in an outpatient setting.
Yeah, it's really matchmaking if you think about it.
That's correct.
Finding the best, the right, what did they say? The right patient, or the right procedure for the right patient in the right location, right?
Absolutely.
I mean, that's like, the commandments for OBLs these days and ASCs is just making sure that patients can be taken care of safely and effectively in the right location, especially. It's very important for OBLs and ASCs because something that's more complex, maybe there'll be an algorithm in 5 years that says, no, this patient needs to go to the hospital.
Correct.
This is a high risk. Do not do this in OBL. Your chance of failure is, 95%,
Absolutely. Absolutely.
which would be amazing. I think that's going to be great. And so I love the concept, Reza. And, the other thing that I always think about, I'm like you, like I kind of geek out about marketing stuff is, how do you then market this marketing solution to physicians? How are you getting in front of docs to, again, you can't, you're a startup, you're just getting going. How do you get docs to start playing with it to get that feedback to then iterate, improve, and get to where you want to be?
That's a great question. I mean, you talk about challenges, right? How do we get doctors to trust us? That's my question. How do we get that 15 to 20 minutes of their time, their valuable time, to come and actually register there and they're not worried about it? Number one thing is I feel like our approach, because we learned from ZocDoc, we know that if we ask them to subscribe and put their credit card number and give us so many dollars every month, that's failed. So that's not going to work. So we're not doing that. This is a free service. This is a free service until we get you a patient who will have a procedure done. So that's number one. Number two is in this whole noisy environment that you're getting so many emails about, oh, hey, doctor, let us send you 5 patients. Hey, doctor, we want to get you here to be an expert and we'll pay you $100 an Amazon gift card, this, that. And everybody's like, if everybody's like me, you're like, just delete all, right? So how are we going to get recognized? I think number one thing is our presence in the community and in the meetings, in societies. We talked about this. We need to get out there in these scientific settings and sit there and try to help and, team up with these doctors. We tell them, hey, this is a real company. This is not going to be waste of your time. If you come in here, we have a plan, we have a strategy, we show with our presence, we show that we are serious. With the fact that we're going to go into multiple meetings for next year, we have planned multiple meetings. We talked about this, as you remember before this. We're planning to go to ISET. That's the next one coming up. We are going to OEIS. That's exactly the audience that we are looking for. We are going to find probably pain management conferences. That's my next plan, because I feel like a lot of pain management's also scattered between specialties. So we need to find pain management and go to their conferences. And the other thing is, I feel like our goal is to also focus on primary care physicians and providers education too. I feel like if we can help with that, because we talked about this face-to-face referral, talking to referral physicians, and although it's outdated and it's difficult to do, but it's still valuable. So let us, as Doctorize, as your partner, let us do that. So let us to go to meetings for family physicians, for primary care providers. Let us go there and show ourselves and tell these people that we have created a network of people you don't know much about, and we can actually educate you about it. So my goal is to create a third. Right now, our website at our platform has 2 arms, for patients and for doctors. My goal for doctors who are interventionalists, my goal is to create another branch in the platform for primary care providers. For the educational efforts, just letting these people know what options are available. How many times you went to a primary care and told them about prostate artery embolization and they were like, really? You guys can do that? So we need to, in order to change their pattern, because the minute they hear prostate, they think of urologist, or in order to change their pattern of when they hear osteoarthritis, they think of orthopedic surgeon. In order to change that pattern, you have to educate. Otherwise, it's not going to be possible to get into those practices, because people still, especially older generation, they still trust and they still get most of their healthcare advice from their primary care. So we need to engage those primary care physicians as well in the website. So my goal is with offering this service for free, showing our face in conferences, establishing a presence in local community. We are planning to, again, this is the second phase, but we are planning to have a sales force. So at least we start with large cities, and we have like people on the ground that going into these offices and talking to people to sign in. I feel like those are the approaches, at least 3 approaches that we have thought about.
Okay, so that's the first part of the question, which is basically getting the physician profiles on there. It's like throwing a party, right? Like, okay, you got to get some people, you got to get some people to show up so that more people show up, right?
Correct.
And so from the patient perspective, if you go on the website and there's no doctors in your city, that's a problem too, right? So you're solving for that by getting the physician profiles on there. But then from the physician perspective, it's like, okay, I've had my profile on here. Where are all the patients? Where's the website traffic on that side? How are you solving for that problem? How are you trying to get patients to come on?
The patients campaign will start, as I said, when we create that network. The initial network, when it's created, when I know that I have at least 2 or 3 interventional radiologists on the website, already signed up, ready to go, that's when we're going to shift or maybe start another effort to work on patients, how to get the patients. And that's what it comes down to, social media. So as you know, social media these days, as I said, as generations are changing, more and more people are getting their healthcare trends from social media. So we're going to go to social media. Right now, we're only on LinkedIn and X, because it looks like that's where the doctors network. So we're not focusing on patients, but as soon as we start focusing on patients, we're going to go on Facebook, we're going to go on Instagram, we're going to go on TikTok. And obviously, again, what we need to do is to do press releases, for example. Those are going to be important. Being on this podcast, you are the leading podcast for this space. So being in this podcast, it's a huge opportunity for us to get out there. But our effort to get the patients is going to start when we have that, like you said, atomic network. Because without that, we won't be able to create attraction from patients.
Yeah, the fourth one that I always think of when I think of patients is YouTube, because it's the number 2 search engine after Google, but it's also, I consider, a social media platform because of YouTube Shorts. I mean, people, especially younger generations, are just they're going through those shorts.
Absolutely.
And so I always think of content marketing, any kind of video stuff that you're going to create around, for example, an enlarged prostate. Like, have you guys I know that that's down the line, but have you thought about how you're going to create that content? Is it going to be primarily driven from the physicians who you have on, or are you going to create that kind of content yourself?
That's very interesting. I actually have another company that we started, and we're still working on it, and that's creating educational animations for patients about our procedures. So we have created one of my partners, Dr. Nizami, is working on that front. He has actually created some. I know you have talked to also Dr. Mina Makari in regards to that patient awareness. So our goal is, like they say, people come for the network, but they stay for the opportunities that are there, for the tools that you provide for them. So that's our goal. We create the network at the same time. Like, for example, we created this beautiful animation for thyroid biopsy. that's like our initial product that we have, and I can share it with you. And our goal is to create content, right? As I said, if you want to be in the first page of Google, your content should be updated. By the way, you cannot use AI to create content because now Google is actually following that and they're finding what's AI generated and they downgrade you. So you need to have content created. That content, for example, look at the Wikipedia model. Wikipedia comes from, majority of Wikipedia content comes from volunteers. So we actually talked about this too. So for example, the same thing for Radiopedia. Remember the early days of Radiopedia? Like everybody, like they were asking, hey, do you want to do a article about such and such disease? And now Radiopedia is one of the best search engines for radiology.
Absolutely. Yeah.
Everybody uses it. I use it all the time.
I use it. I never bought StatDX in practice because I was like, Radiopedia is free.
Correct.
And it's easier to access. I don't have to sign in.
Correct. And it's all volunteer based.
Right.
So imagine the opportunities, for example, I mean, that I was back in the day, I was involved with creating residence fellow section of SIR. You remember those days. But remember, look at the workforce of interested medical students and residents and people we have there. And if we can engage them into this process, if they come in and create content for us, which is reliable, which is updated, which is, and also it has to be kind of in a layman's terms. So, because a lot of times, like when the doctors go to talk to the patient, I don't think a lot of them recognize that patients don't grab some of the material they're presenting. So we need to be very careful in terms of the material that we're presenting to the patients. It has to be in a way that patients are comfortable with understanding the material. So I think the approach right now, we have a professional who creates content for the website. We're starting to roll out our content. It's going to be very soon. It's going to be multiple articles are coming into our blog section of the website. But in the future, I think we can, if we are successful and we create that traction, we can go through volunteer involvement and get people to come and create content and submit to us, and that's very valuable.
Yeah, absolutely. Has it, like on that in terms of society, have there been any societies or other companies or individuals that have been significant advocates or supporters in this endeavor so far? I mean, I know it's still early days, but sometimes like somebody just comes along or society comes along and just like, hey, we believe in what you're doing. How can we collaborate? How can we support you? Have you had anything like that happen?
Yeah, so I would say ISET has been, and my people at Miami Vascular, Tino Pena is involved with the project. With their support, actually, that's how we got to go to ISET. We got involved with their hall, and we got our registration set up, and we need to go in there. But for example, Tino Pena is very positive about this. He loves the idea and he wants to see us succeed. So that's one example I can give you.
Yeah, that's fantastic. I mean, that always helps. For us, early days was like interventional initiative with Isabel Newton and Susan Jackson, and then they were there for us and kind of helped get the word out. And even just when we were just getting started, and we couldn't believe it. So yeah, that's always helped when somebody believes in what you're doing and kind of gives you a little bit of a boost in terms of exposure.
Absolutely.
And so, Reza, as we've been talking about almost an hour now, but I wanted to get to you as an entrepreneur. You're busy with clinical practice. I know how it is. How do you balance, building this platform, which you're obviously very passionate about, and your clinical work? And then obviously there's family that's top of the food chain, but you're busy. How does it all work?
One thing is my family, like you said, like my wife. She's the most supportive person I can tell you. She's like, she listens to what I say. She's like, a lot of people are like, why do you want to do this? Like, you just go to work, you have a comfortable life, you like what you do. right now I'm in a great practice. I'm a partner in this practice. We're doing so well. I love my day job of interventional radiology. But number one is my wife. I can tell you that support, if that wasn't there, I couldn't do this. Number two, I would tell you, I have very good team members. One of the, as I mentioned before, Nicole Vox, who is our co-founder. I have worked with Nicole previously, and she's a medical marketer for 18 years. She has worked throughout medical industry, healthcare industry, in marketing specifically, in so many different roles. She understands exactly how this is done. Like, where are the bottlenecks? What do we need to do? How we need to approach a problem? And I love that. For that part, I can tell you, for most of it, it's Nicole. And then we have our marketing director, Anastasia. Anastasia she has been also in marketing environment. She didn't do medical marketing, but she understands marketing as well. And I feel like right now, I'm just more like delegating tasks and making sure, like, you need to have a team that you trust. So when you tell someone, hey, this is something that needs to be done, you want to make sure that that person is actually doing the job and completing the task of coming back to you. And that's I have been so lucky with that. I found the people, I don't know if you call it lucky or, you do some research, obviously. And Nicole was my coworker, so I actually knew how she works and what's her work ethic. So we have been doing this as a team effort. And time management, as you know, I do a lot of time management. I kind of prioritize the tasks. So if there is something that can go down the road and it can wait for me to take care of it in a few days, I'll never worry about it. And let's just do time management, make sure that stay healthy. I still work out, try to go to the gym and try to run and do this and that. So yeah, I feel like the most important thing is the team. It could be your personal team as well as your professional team, but it's a team effort.
Absolutely. You need that support all at home and at work. Absolutely. And
100%.
There was something you said at the beginning about comfort and discomfort. And I think a common theme amongst all the entrepreneurs that we've had on the show that I've talked to personally, you got to be okay with a certain level of discomfort. And it's almost like you get uncomfortable with being comfortable. It's like you're restless, like, I accomplished all these things, but I got to do something else that, it's going to cause some anxiety. It's going to cause some discomfort, but I got to do this. It's got to be challenging, right? Life's got to be challenging in some way.
Right.
And it's funny. It reminds me, have you ever seen Talladega Nights with Ricky
Yes.
Bobby?
Yes.
Yeah. You know how his dad gets kicked out of Applebee's? He's like, sometimes you just got to feel like you got to get kicked out of Applebee's, It's like,
that's absolutely right.
It's like you just feel this is comfortable, but it doesn't feel good. And I feel like, and you and I both know people like that in practice now today they've got everything. They've got the great house, but they want to feel that discomfort. They want to do something like this.
Correct.
But it takes a little bit of courage and it takes some support. Absolutely. You have to have a wife who's on board or, a life partner, who's on board with it. You have to feel okay with maybe not being financially comfortable for a few years, right?
Yes.
Like there's a lot of things that go into it. And I think that's what scares people. But I would say absolutely no regrets through all the ups and downs, even, early days where it's really scary. You just put a bunch of money into something, but you just gotta do it and you gotta feel that discomfort because that's how you learn and grow. And so you said that and I was like, that is actually it right there.
Yes.
I think that is the common theme of a lot of entrepreneurs, especially physician entrepreneurs, is like, you're okay with that discomfort.
Yeah. And I will add kind of to what you just said, two other things. One is I feel as I said, I was part of the effort that created a resident and fellow section of SIR. I feel responsible also to the next generation. The people who are coming, like the other day, I saw like these big numbers of like there's increase in number of applicants to IR. It's one of the hottest and most competitive specialties to get into. I feel like we need to give them the tools, right? So like the example that Jeff Bezos gives, right? He wanted to create Amazon. He needed tools. And I heard this somewhere in a podcast or something from another person, but he said all I needed was postal service and internet. And those tools were available, and I created Amazon. So, I feel like we need to create the essential tools for the next generation of IR and interventionalists. It's not just in interventional radiology. All the interventionalists coming out, and they want to have their own practice. As I said, there's a big movement. There is this big effort of, independent interventionalists out there. So in order to enable those people, we need to give them the tools. And one of the tools, I feel like one of the tools that is being ignored and being overlooked and not being discussed throughout traditional training is how to market yourself. I had this problem myself coming into this profession. I was coming in from a very well-oiled machine that's called Miami Vascular with years and years of experience, years and years of people spending extra hours creating this huge practice, which is nationally and internationally renowned. I was coming out and I'm like, well, I get to this job and nobody sends me patients. What's going on? Why this was not? So I didn't realize I never market myself. I got into these practices, like academic practices, and I was like, no, there's a problem here because we're not getting patient referral. And now I look at it after 10, 11 years, and I'm like, no, I was wrong. I should have created my own market. I should have gone out there, talked to people, found ways for the referring physician to trust me like they trusted Miami Vascular. They didn't trust Reza Rajebi in Miami Vascular. No, they trusted Miami Vascular, and I was there as a fellow. I had the privilege to be from, part of that system. So I didn't realize that. Nobody taught me that. So I think one of the reasons that I'm doing this is I'm trying to create this environment so the younger generation who are more comfortable with digital media, with social media coming into this, they realize that we as kind of an older generation, we call ourselves now, which is pretty sad. But as an older generation, we understand their obstacles, we understand their problems, what they're fighting for, and we're going to try to help. I would like to help with this whole thing. So that's one of the goals of doing Doctorize. I feel like, we also owe to this new generation to give them the tools, like Jeff Bezos said.
I think it's one of the key knowledge gaps that we have as physicians throughout our career. From green to even older, where you have guys like Jafar Gozarian, who just left academics. He's out there on his own now.
Sure.
I mean, it's amazing. It's like the courage that it takes to do that. It's
so
incredible.
Brave.
But he's like, I'm figuring out this marketing thing myself, right?
Yep.
And the other kind of sad thing is for whatever reason, industry is not allowed to support practice building content, which is crazy. But where do we get this information from? And it has to come from ourselves. And like you said, we're going to have to create this content. We're going to have to put it out there. We're going to have to share it with each other.
Right.
It can't just be at a conference that you go to once a year. Those are great sources. Definitely go to OEIS if you want to learn about that stuff. But we want to get it, and that's part of what we're doing at Backtable. We want to get this stuff out year round, have it available all the time. And I think that that's going to be key to y'all's success, is getting some content marketing out there that, again, like you said, like adding value to their day-to-day, to their practice.
Absolutely.
And so that's their tool. They come to your website to have, so that patients can find them. But also while they're there, they're going to learn something. There might be like a calculator, a prostate calculator. There's some kind of tool that keeps them hanging around.
Absolutely.
That's what makes it sticky. You know what I mean?
Absolutely. Yeah, that's the concept. Like you said, it's come for the network, stay for the tools. So that's going to be our goal and our challenge for next year, because that doesn't exist, right? For ZocDoc, that doesn't exist. ZocDoc is basically an appointment-making website. You go there, you create your profile, and you come out, and you probably never go back. So that's what's going to be differentiate us from our top competitor.
Fantastic, Reza. Well, I feel like we covered it all. Is there any, final words, anything you want to leave the audience with before we finish up?
I wanted to, again, just thank you for giving us the opportunity to be here and talk about this. This is huge for us because, as I mentioned, your podcast is the leading podcast in this area, and I feel like we are lucky to have you. You have been doing this for so many years. You have put so much effort in this, and we really appreciate that. I appreciate it as an interventional radiologist. So I just want to let people know, just come and partner with us. Let us help you. That's what we want to do. We're not going to be out there trying to charge you for something that we do not provide. We only work with you based on value that we provide. And also, this is not just a Dr. Finder website. If you are in need of having someone who does your marketing, who does your website, for example, creates a website that is actually optimized for search engine, runs your ads, do your social media, run your social media, that's another service. That's kind of an ancillary service that we will provide. We have the effort, we have the people, we have the network, and we have the team to provide that. We have experience, like I said, more than 70 years experience in marketing is behind the company. So just let us help you.
Fantastic. Well, thank you so much, Reza, for coming back on and coming out to San Diego. Like I mentioned before, I'd love to have you in the studio next time.
Absolutely. Thank you. We'll be there.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend. If you have any questions or comments, DM us at Backtable Innovation on Instagram, LinkedIn, or Twitter. Backtable Innovation is produced and hosted by Brian Hartley,
Aaron Fritz,
Diana Velasquez-Pimentel,
and Eric Amaker.
Our audio team is led by Kieran Gannon, with support from
Josh McWhirter,
Aaron Bowles,
Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Ann Dang.
Administrative support provided by Jamila Kennebrew.
Thanks again for listening.
See you again next week.